Good morning, guys. Welcome back to my YouTube channel. I'm Miss Henderson. I am a nurse educator, and today I am going to be demonstrating to my CNA class how to perform range of motion. So that being said, there are two types of range of motion. There is active ROM. Active ROM is when the patient does the exercise for themselves. Passive range of motion, or PROM, is when the CNA does the exercise for the patient. So this is one of Prometric scale, performing passive range of motion for a patient who is bedbound. So I am going to demonstrate to the class how to perform passive range of motion to the shoulders. Also, I am going to show the student how to do exercises to the arm, abduction and adduction. Let me define these two terms. Abduction is when you have a body part and it's closer to the midline of the body. This is adduction. This is abduction. Abduction is moving the body part away from the center of origin. I'm also going to demonstrate to the student how to do flexion and extension of the arm. So that being said, let's dive into the content. So the first thing I want to do when I come in to my patient, I want to knock. Hi, good morning. My name is Miss Henderson and I am your CNA today. And today I am here to help you with some simple exercises. Is that okay with you? Patient said yes. I'll be right back. I am going to go wash my hands, gather my supplies, and come right back. So I go, I wash my hands, 15 to 20 seconds, I come back. When I come back, hi, you're Mr. Jones. Hi, Mr. Jones. What is your date of birth? October 4th, 1949. Great. Mr. Jones, I am going to raise my bed to working level to maintain proper body mechanics. At this time, I am going to lower the side rail that I'm going to be working on. I am going to lock my bed for safety. I am going to screen the patient to maintain privacy of my patient. Mr. Jones, before you start the exercise, ask your patient, are you feeling any pain or any discomfort? You don't want to start an exercise and then he has pain. How are you going to exercise him, right? We want to make sure he is not in any pain. So we are going to do the exercise. We're going to put the body through 3 revolutions. 3 cycles of passive range of motion. So the way you do that, you support the joints and you go. 1, are you feeling any pain or any discomfort? He said no. 2, any pain or any discomfort? 3. So I have demonstrated how to do passive range of motion to the shoulder area. Now I am going to demonstrate to you how to do abduction and adduction exercise. So you support the patient's the elbow area and you abduction away from the midline. Adduction. Are you feeling any pain or any discomfort? No. Abduction. Adduction. 2. Abduction. Adduction. So I have did the shoulders and I did the elbow, right? So now I want to show you how to do flexion and extension. Flexion extension, flexion, extension. Are you feeling any pain or any discomfort? Flexion, extension. 3. So those are the 3 exercises, passive range of motion to the patient's arm. So when you're doing the exercise, make sure you ask your patient about comfort level. You want to establish that. So when you finish the exercise, what do? Cover your patient back. You also want to lower the bed before you walk away from your patient. You don't want to leave the bed in a high position because that is not promoting safety. So you lower the bed into the lowest position. And you also want to have the call bell within close reach. So I have the patient's call bell. Mr. Jones, here's your call bell. It's within close reach. I'm going to lower my bed for safety. Said he wants his head to be elevated a little bit. I'll elevate his head a little bit. And I would take a moment to review my skill. Did I hit on each element of the skill? And I think I have done so. I'm going to remove the privacy curtain, and my bed is in lowest position. The side rails are up for safety, and call bell is within close reach of my patient. Mr. Jones, that's it. So your exercise is done. If you need anything, please feel free to call me, and I will be sure to answer your call bell. So guys, that's it for this video. Again, if you like these types of content and these types of material, please consider subscribing to my YouTube channel. Please like and share and give this video a thumbs up. And I will catch you in the other video. I hope these videos can really help CNA students to, you know, you do the skills with the students in the classroom. The professor demonstrates it once. Some students, you have to do it a few times. You can't just do it one time and you expect the student to get it. Some people learn differently. Some people are slower learners. Some people could learn by visually seeing you doing it repetitively. Some people would read a book. Some people will watch a video. And that's why I create these simple videos. So when I do the skill, my student in the comfort of their home, or when they're driving with their car going home, they could say, listen, I have to do this skill. Let me just look at this quick video, and can help them to understand. Thank you so much. Have a great day. And please subscribe to my YouTube channel, guys. I know you're looking at my content. I know you're getting something out of it. Please, I'm begging you, please subscribe. And please give it a thumbs up and drop your comments below. I'll catch you in the other one. Bye.